Gold FM, only the classic hits, 23 minutes past 11 o'clock. Well, like I'd mentioned earlier on today on the Center Show, we're joined by Dr. Prithvi Mohandas, the Managing Director of MIOT International, and we'll be discussing the latest in healthcare innovations and what MIOT is doing to improve medical services in our region. And also, Bulavinaka, Dr. Prithvi, thank you so much for joining me today. I really appreciate you taking the time to speak with me.
My pleasure.
Now, before we dive into, some of the exciting developments, in your field, could you briefly start by telling us a bit about MIOT International Hospitals? I mean, for those who may not be familiar, what makes MIOT stand out?
Well, I think a lot of Fijians may be aware of the hospital in Chennai in South India. We've been coming to Fiji since the year 2015 and of course, briefly in partnership around the cardiac services at the old Suva Private Hospital. The hospital in Chennai is possibly the only hospital in India with 3,000 full-time staff who don't work anywhere else. And it's housed in a 14-acre campus parallel to Chennai Airport. The outstanding feature of the hospital is that whoever runs the hospital has to live in-house. So these are some of the rather unique aspects of MIOT.
Wow. Now, what is the link between MIOT International, MIOT Pacific Medical, and Fiji Care Insurance Limited?
All right. So MIOT receives a lot of patients from Fiji, and obviously it's not next door to Fiji. It's around a 20-hour journey to get to South India from Fiji. And therefore, a lot of Fijians who come to us for complex treatment do need to be followed up. It's very expensive for them to travel back for follow-up. Of course, some of them can just have online consults, but some of them need to be examined, to be looked at face to face. And of course, some changes may need to be made, especially if these are cancer patients. So we have teams that conduct follow-up at the MIOT Pacific, which is in Suva. With regard to Fiji Care, a lot of insurance companies in the Pacific send us patients, and one of them, of course, is Fiji Care. The executive director of Fiji Care, Mr. Ravi Raju, has been a friend of mine ever since he got married to somebody who's of Indian origin and who's a close family friend. But otherwise, there are no financial interests that MIOT International has in Fiji Care.
Mm-hmm. Well, that sounds really amazing. I mean, you sound like you're in a step in the right direction in terms of making specialized healthcare more accessible here in the region. There is a symposium happening this week at the Grand Pacific Hotel. Can you shed some light on this event?
Well, I think that for a long time we have heard this misconception that small islands with relatively smaller density of population cannot afford to scale up to high quality healthcare simply because the numbers don't add up. And it is to completely bust this myth that we decided to have this symposium. We ourselves are present in geographies much tinier than Fiji, with much smaller populations, with great degree of success.
Mm-hmm. And that sounds great. MIOT being a 1,000-bed multi-specialty hospital based in Chennai, it does provide services with state-of-the-art infrastructure. Can you provide an overview of some of the services and specialties that MIOT International offers, and how can that benefit Fijians and also people of the Pacific?
I think that more important than the building more important than technology, because both of these can just be bought with money. The unique character and virtue that MIOT possesses that attracts a lot of Fijians to MIOT is integrity. There is no treatment, no procedure, diagnostic or curative done by MIOT unless it is genuinely required. MIOT itself, the mothership in Chennai, is a quaternary hospital. So what that means is it basically deals with diseases that are very difficult to treat, with advanced conditions that nobody else wants to treat, or dealing with patients who had multiple treatments that have failed and now who are seeking a solution. So that's the term quaternary.
Well, it's great to know that kind of support is available, especially for cases where treatment might not be easily available locally. I understand MIOT International attracts patients for over 130 countries, but I also believe that MIOT operates in other countries as well. Can you tell us more about that and perhaps dwell on some of the services that may be offered to Fijians in the future?
I think that India as a whole has seen a growth on the academic side of healthcare, where we are now producing super specialists who are capable of very rapidly embracing new technology and performing advanced treatments at a very reasonable cost. Reasonable cost does not mean free, but at the same time, it does mean far less than the same treatment with the same outcome in the Western world. As a result of this, India has become the most favored destination for countries in the region. And these are the countries around India, like Bangladesh, Nepal, Sri Lanka, obviously very close to India politically as well, and countries that India historically has been close to. And these are the countries that, along with India, are friends of India, especially when it comes to the UN. And these are countries in East Africa, Central Africa, some of West Africa, and a large part of the Middle East. So we attract patients from 130 countries, but also we identify certain conditions and disease patterns exclusive to certain smaller countries and try to offer end-to-end treatments at their doorstep so that they don't have to travel out of their country for everything that's required.
That really sounds exciting. Now, before we wrap up, is there anything else you'd like to share? Maybe a message for Fijians or for healthcare providers here in the region?
Well, I think, I've been coming to Fiji now for the last 10 years. We're very excited about the way healthcare has developed in this country. We've already run and continue to run the cardiac services at Lautoka. We've already performed over 300 open heart surgeries with less than 0.5% mortality. So we're now looking to expand our services in Fiji. And I think this is a hugely exciting time for the country, where operators like myself feel that there's a great future in healthcare for this country and its people.
Well, thank you very much, Dr. Prithvi Mohandas. I really appreciate you making the time, especially with how busy your schedule might be. It's been a privilege speaking with you, and I'm sure listeners will take a lot away from this conversation. And take care, though, and best of luck with the symposium this week.
Thank you very much.
Naka.